I'm Colleen Belahoric. This is my video submission for PFT 1220 Myofascial Lines. With the help of my furry frog friend, I'm going to show you the superficial front and back lines, the lateral line, spiral line, and the functional front and back lines. Let's begin. This is the superficial front line, which is divided into two parts. The first part begins at the foot at the dorsal surface of the phalanges. It goes along the toe extensors and the tibialis anterior to the tibial tuberosity, along the subpatellar tendon to the patella, along the rectus femoris and the quadriceps, finishing at the anterior inferior iliac spine. The second part of the superficial front line begins at the pubic tubercle. It goes along the rectus abdominis to the fifth rib, then along the sternalis to the sternal manubrium, along the sternocleidomastoid to the mastoid process, and finishes with scalp fascia. Movement function of the superficial front line is flexion of the trunk and hips, so a sit-up, extension at the knee from bent to straight, and dorsiflexion of the foot. It works with the superficial back line to maintain postural function of upright posture. This is the superficial back line. It begins on the ventral surface of the foot at the toe phalanges, goes along the short toe flexures and plantar fascia to the calcaneus, along the Achilles tendon and the gastroc to the condyles of the femur, along the medial and lateral hamstrings to the ischial tuberosity, along the sacrotuberous ligament to the sacrum, along the erector spinae to the occipital ridge, along epicranial fascia, finishing at the frontal bone and the supraorbital ridge. Movement of the superficial back line is flexion at the knees and extension of the spine and trunk, so a cobra lift. The superficial back line works with the superficial front line to maintain upright posture. So you can see they work together. When the superficial front line is contracted, the back line is extended, and when the back line is contracted, the front line is extended. This is the lateral line. There is one on both sides of the body, but I will just show you the right side. It begins at the bases of the first and fifth metatarsal bones in the foot, goes along the peroneal and lateral crural compartment, along the fibular head, the anterior ligament of the fibular head to the lateral tibial condyle, goes along the iliotibial tract to the tensor fasciae lata and the gluteus maximus, attaching at the iliac crest and the anterior and posterior superior iliac spine, goes along the lateral abdominal obliques attaching at the ribs, and goes along the internal and external intercostals attaching at the first and second ribs. Please note here that there is a crisscross pattern of the lateral line. It goes around the arm, along the splenus capitis and sternocleidomastoid, finishing at the occipital ridge and mastoid processes. Movement of the lateral line. Lateral flexion of the trunk in a side bend, lateral abduction of the hip, and eversion of the foot. The lateral line's postural function is to balance the front with the back and the left with the right, and it also maintains postural integrity of any movement that involves the arm. This is the spiral line. For simplicity's sake, I'm just showing one spiral line, but the mirror image does occur. The spiral line wraps the body from head to toe and back again. We will begin at the anterior superior iliac spine. We follow through the tensor fasciae lata and iliotibial band to the lateral tibial condyle. Then we goes along the tibialis anterior medially to the bottom of the foot, where it attaches at the base of the big toe. It wraps around the foot to the back of the leg, where it goes up the peroneus longus and attaches at the fibular head. From here, it follows the biceps femoris to the ischial tuberosity, then along the sacrotuberous ligament to the sacrum and up the erector spinae to the occipital ridge. Then, from the mastoid process, it goes down the rhomboids through to the contralateral serratus anterior, around the body under the armpit, to the contralateral external obliques, to the ipsilateral internal obliques, then back to the anterior superior iliac spine where we began. The spiral line mediates rotations in eccentric and isometric contraction and also steadies the trunk in movement to prevent rotational collapse. Posturally, it maintains balance in all the planes and helps the knee tracking as we walk. The back and front functional lines are rarely used for standing posture, but they are used in activities where one side of the body is moving and the other side is stationary, like serving a volleyball or bowling. The back functional line begins at the humerus, goes across the lats, through the glutes, down the vastus lateralis, and wraps around to the front of the leg and finishes at the tibial tuberosity, while the front functional line also attaches at the humerus, goes across the pectoralis major, the abdominals, and finishes at the femur. What is unique about these functional lines is that they are also aided in breathing.